Addiction has become a major public health issue in this country, including in our community. We're seeing the impact of that as we are with many other chronic diseases. It's driving healthcare costs. Addiction is costing as much as heart disease, diabetes, cancer in our community, and it has become the leading cause of death for 25 to 54-year-olds in our state over motor vehicle accidents. So we are seeing the impact of this as we continue to see additional issues come up. The latest being the lacing of heroin or the availability of fentanyl in our communities. We've seen 3 deaths in this state in the last couple of months. They're lacing heroin with that particular substance because it's cheaper and it gets a very quick high, but it's almost always fatal. So we're continuing to try to find ways to work with our community to prevent that. In addition, we're seeing additional cases of meth in our community, methamphetamines. So we know that we have an addiction problem here. We have the highest rate of hepatitis C in our community in this state, and that's mostly due to injection drug use. So we know we have an issue. So we need to make sure that people understand the issue. We need to make people understand what they need to do about it, how they can educate their children, how they make sure that their children do not have access to drugs of any kind, and how we talk about addiction in this community. Working with law enforcement to make sure that we keep the drugs off the streets as much as we can.
I wanted to take the opportunity today to talk a little bit about acetyl fentanyl. We're very familiar with fentanyl patches as a prescription drug, and we have had accidental deaths with overdoses from fentanyl. It's a very powerful drug, even in a prescription form. But we're beginning to see a new form of this drug, acetyl fentanyl, which is not a pharmaceutical drug, but has been manufactured to be a synthetic opioid. The problem with this drug is it is generally sold as some sort of a crystalline powder that many people mistake for heroin or a pure form of heroin. And when in truth it is really about 5 times more powerful than what that heroin would be. So what we're beginning to see across the country now are accidental deaths of people who think they're using heroin, but they're actually using this new form of fentanyl, this acetyl fentanyl. Here in Buncombe County, we are working through the Buncombe County Anti-Crime Task Force with our DEA task force in identifying this drug along with the other very dangerous narcotics that come to and through Buncombe County, and we are especially working with surrounding counties on awareness of acetyl fentanyl and the dangers of overdose deaths.
It takes a united effort. It takes working with public health, with law enforcement, with the school systems, with our community at large. We need people to understand that addiction has to do with illegal drugs, but as well as prescription drugs. Our children have access to our drug cabinets, to their grandparents' drug cabinets, and we're seeing that have an impact as well.
Fentanyl is a man-made drug that is similar to naturally occurring opiates. It's a prescription drug that is used to treat severe and chronic pain or for anesthesia. Acetyl fentanyl is chemically similar to fentanyl, but is illegal and not available by prescription. There are no published studies about the health effects or safety of acetyl fentanyl, and it looks similar to heroin. Same color, same consistency, sometimes same packaging. It's possible that heroin users could mistake acetyl fentanyl for heroin and take a very big dose of it, which could lead to overdose and death. Symptoms of an overdose of acetyl fentanyl are similar to symptoms of an overdose of any opiate and would include damp, cool skin, pinpoint pupils, slowed or stopped breathing, unconsciousness or being severely drowsy, a low blood pressure, a slowed heartbeat, or seizures. Opiates work by binding to receptors in our brain that are located in areas of pleasure. And so when somebody takes an opiate, that part of the brain is essentially tickled, and the person feels pleasure, feels euphoric, feels happy, and it's a reward center, so the more you tickle that part of your brain, the better you feel. So if you suspect somebody is overdosing on acetyl fentanyl or any opiate, the most important thing is to get them emergency care. There is a prescription medication called naloxone that can reverse the effects of acetyl fentanyl and other opiates, but the sooner you give it, the greater their chance of survival. Unfortunately, people can become tolerant to opiates, so that the more they use, the more it takes, the greater the dose it takes in order to feel that same sense of pleasure. And that can lead to a physical addiction, a psychological addiction, where they need that drug in order to feel happy. And if they don't have it, it can lead to symptoms of withdrawal.
So we do have a concerted effort going on right now through the Drug Commission of Buncombe County. And that effort is focused on a project called Project Lazarus, which is looking at specifically prescription drug abuse and how we prevent children and others having access to drugs that they really have no business accessing. So we'll continue that work, but we also need the community to understand the issue and to help us as we move forward.